presented by Clinical Core. This presentation is designed for doctors and medical students to enhance clinical understanding and management. Type 2 diabetes is a chronic metabolic disorder characterized by insulin resistance and relative insulin deficiency. It accounts for 90 to 95% of all diabetes cases globally. Pathophysiology. Type 2 diabetes involves insulin resistance in muscle, liver, and adipose tissue, leading to decreased glucose uptake and increased gluconeogenesis. Beta cell dysfunction results in insufficient insulin secretion in response to hyperglycemia, creating a cycle of glucotoxicity and lipotoxicity. Epidemiology. The prevalence of type 2 diabetes is rising globally, driven by obesity and sedentary lifestyles. Key risk factors include obesity, physical inactivity, age, family history, and ethnicity. South Asians and African Americans are disproportionately affected. Slide 5. Clinical presentation. Patients often present with polyuria, polydipsia, and fatigue. Physical signs may include acanthosis nigricans, indicating insulin resistance. Some patients present with complications like neuropathy, retinopathy, or cardiovascular disease at diagnosis. Diagnosis is confirmed through tests: fasting plasma glucose of 126 mg/dL or higher, HbA1c of 6.5% or greater, or a 2-hour plasma glucose of 200 mg/dL or higher during an oral glucose tolerance test. Clinical context is crucial. Management. Management involves lifestyle modifications and pharmacotherapy. Lifestyle changes include diet, exercise, and weight loss. Metformin is typically the first-line agent, followed by sulfonylureas, DPP-4 inhibitors, GLP-1 receptor agonists, and SGLT2 inhibitors. Insulin therapy may be required in advanced cases. Glycemic targets and monitoring. Glycemic targets should be individualized, generally aiming for HbA1c below 7% for most non-pregnant adults. More stringent targets may be suitable for younger patients, while less stringent targets may be appropriate for older patients with comorbidities. Regular self-monitoring of blood glucose is essential. Complications. Chronic hyperglycemia leads to microvascular complications like retinopathy, nephropathy, and neuropathy, and macrovascular complications like cardiovascular diseases, including myocardial infarction and stroke. Early detection and management are critical. Special considerations. Special considerations include addressing the needs of elderly patients with multiple comorbid conditions and a higher risk of hypoglycemia. Psychosocial factors such as depression and diabetes distress should also be managed. Prognosis. The prognosis improves with early intervention and sustained management. Comprehensive care, regular follow-ups, and patient education are essential to prevent complications and maintain quality of life. Conclusion. In conclusion, type 2 diabetes is a complex condition requiring a multifaceted approach. Early detection, individualized treatment, and ongoing education are key to improving outcomes. Thank you for